Every day, I consult with people who have been told they're normal by conventional medicine. Every blood test, every diagnostic test they've had done is normal in the eyes of conventional medicine. So ultimately, they're funneled towards a psychiatric or anxiety or depression diagnosis and offered a medication. Are these people actually normal? Absolutely not, because they don't feel good and they have signs and symptoms. But because the testing isn't showing it, the conventional model says they're normal. How do we tell what's really going on? That's what I want to talk about today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. What we first must understand to answer this question is the paradigm that the quote unquote normal is coming from. In conventional medicine, they are focused on acute issues that are life threatening. So they're looking for a tumor or a fracture or a hemorrhage because those are life threatening. And that's what they do, that's what they're best at. If they run their testing and there's no sign of fracture or tumor or hemorrhage, then for all intents and purposes, you're normal because you're not going to die today. If you have a chronic issue, that's not their wheelhouse, that's not what they're great at. And as America is a perfect example of, you need to go elsewhere to get the true help you need. So every day I'm consulting with people that have had all the conventional tests and been told they're normal. Well, yes, they're normal from the paradigm that they're not at risk of dying today, but they're not normal from the perspective of they feel well, they're functioning well, and they're meeting a full quality of life. That is the gray area between true normal and undiagnosed. Okay, true normal is here. This is where the people that I'm consulting with want to be. Undiagnosed is the normal that conventional medicine is telling them they are. But in between there is all that gray area where something's going wrong that's chronic, that's not going to kill them today, but also isn't letting them feel good and function well today. So that's where functional medicine comes in, because functional medicine assesses you in the gray area, in the chronic area. Functional medicine loves that you've had all these tests with conventional medicine because they're looking to find the acute life-threatening things. That's not where functional medicine lives. But when conventional medicine has ruled those things out, they've said, hey, there's no zebras, then we need to look at the horses and see, well, where are things going wrong in the horses? We know there's no zebras, but now all the normal-looking livestock need to be investigated more nuanced, more deeply, to find out why aren't they optimal. So let's get rid of normal and let's use optimal in functional medicine. So functional medicine seeks to do the detective work and find the underlying causes of your physiologic abnormalities that aren't so abnormal that they're diagnosable conventionally yet. They're not life-threatening yet, but they're definitely abnormal enough to make you feel like, hey, I'm not living a full quality of life. I'm not performing the way I want to. I don't have the energy I want to have. I'm not sleeping the way I want to. I'm not the mother, spouse, brother, son, sister, father that I want to be. That's where functional medicine lives, and that's what we want to find out for you and for all these people I'm consulting with is what is the specific or are the specific root causes to them not feeling good that conventional isn't finding because they're not looking, because that's not what they do. So if you're someone who's been told you're normal and you're frustrated with being told you're normal, you want to be told what's actually going wrong with you and how to fix that and address that from a natural and healthy paradigm. Functional medicine is what you're looking for, and reach out to a functional medicine provider today.